Metro Manila Council is set to recommend to the IATF the region's shift to modified general community quarantine by next month.
And it was not unanimous, but the mayors of Metro Manila ultimately voted in favor of easing the region's quarantine restrictions or quarantine status to MGCQ by March.
Yung main consideration ko is yung nilabas ng OCTA research, di ba? Sabi nila hindi pa safe yung below 18, no? Kasi hindi naman po ako doktor. Siyempre, ang tinitingnan natin dito is yung siyensya, yung science, no?
We will need to have to intensify our efforts at contact tracing and implementing localized lockdowns and making sure that the residents comply with the health standards and health protocols strictly.
Majority of Metro Manila mayors have recommended the shift to modified general community quarantine or MGCQ by March. But the OCTA research group warns that relaxed quarantines mean a constant threat of a COVID-19 surge.
Metro Manila, Cebu City, and other hotspots continue to record huge numbers of daily cases, including a patient in Cebu who has tested positive even after vaccination. Meanwhile, with a more lethal variant already present in the country, how can government ensure protection under a relaxed quarantine? We discuss in this episode of The Chiefs.
And this is the Thursday edition of The Chiefs. With us, of course, tonight in the studio is Robbie Lampay of One News. And online, joining us is Luchi Cruz Valdez, the head of News 5. And in a while, we will also have Ana Marie Pamintuan of the Philippine Star. Luchi, Robbie, happy Thursday.
Happy Thursday.
And hi, Robbie.
Hello.
Well, your top story today, I think, is still about COVID-19.
Is our topic tonight. But I mean, just to add to that, even the WHO is warning against relaxing the quarantine regulations in the Philippines.
Si Dr. Abea Singhe.
And then that comes pa with ito nga, yung balita sa Cebu that there is this parang person of interest.
Well, interestingly,
it's a variant.
It's a variant, diba? COVID variant of interest.
There's this overseas worker who came from the UAE who's gotten both doses of the vaccine, who came home and got infected again. And I think he also infected 3 other members of his family. So,
but then the vaccine doesn't really prevent transmission, right?
Well, actually,
pero pati siya nag-positive eh. Diba? That was the ano.
If you, I read an interview of the spokesman of Region 7, DOH Region 7. Sabi niya, the vaccine is supposed to do 3 things: prevent severe disease, prevent clinical disease, and prevent transmission. Yung first 2 mukhang pasok siya doon kasi hindi severe tapos walang symptoms. So 1 and 2 yun. Ang number 3 pa yung question.
Pero kasi to Luchi's point, yun yung tanong natin minsan sa isang guest natin eh, di ba? Kung kahit nag-vaccinate ka na, can you still carry the vaccine? Can you still,
the disease.
Diba?
Kasi nga,
the disease,
if our target is to get 70% vaccinated for herd immunity, if we are still able to transmit the virus even if we're immune, where does herd immunity come in? Because you can still transmit the virus even if you are already immune. Diba? So
anyway, so these are the big stories for today.
Okay, well, let's begin our first guest for tonight. Of course, we are talking still about COVID-19, among other things. We are joined by OCTA research professors Guido David and Professor Ranjit Rye. Actually, our favorites.
Suki.
Ang aming mga suki. Dr. David and Dr. Rye, thank you for joining us and welcome to the Chiefs.
Good evening.
Good evening to everyone.
Good evening po. And welcome back nga naman. Well, yun nga po, as we said kanina, the mayors, although very close yung vote, they voted in favor of MGCQ by March. Of course, it still has to be approved. So it is only recommendatory. And we have also taken note of the concerns raised by OCTA Research. But let me ask you po, has OCTA Research by any chance done any modeling or projections already kung sakaling ituloy itong MGCQ by next month? Just in case, kasi it would be interesting to look at projections if you have any.
Yeah, Ed, I will answer that. And we did have we did present a model.
Oh, okay.
In the model, yes, it doesn't say na this will happen for sure. Ang sinasabi lang natin sa model is what will happen in Metro Manila if a surge similar to what we are seeing in Cebu City takes place or takes hold in Metro Manila. And what we see is that in about 36 days, the number of cases will increase from 400 per day, which is what we have right now, to 2,400
Wow.
Oh,
per day.
that's times 5.
Yes, ganon kabilis lumaki if we follow the pattern in Cebu City. We're not saying this will happen. We're
Yes, sir.
saying that if it happens like in Cebu, if that kind of transmission happens, if, for example, the variant takes hold here in Metro Manila, this could be what we are seeing.
Well, sir,
but,
we're not exactly looking naman, when you did this modeling, you're not exactly looking at MGCQ versus GCQ, no? You're looking lang at superimposing the Cebu patterns with Metro Manila.
Well, actually, there is a factor yung MGCQ because if we recall, during the holidays, Metro Manila was able to mitigate a holiday surge, maybe in part because it was under GCQ. There was a surge starting to happen, but it was mitigated. But in Cebu City, they were under MGCQ, and
Okay.
it was not able to mitigate the surge, and maybe that was a factor. I mean, we're not saying it's a factor, but
Yeah.
it's one of the differentiating features
Okay, we got you
in
there.
the model.
okay, what are the particular, loosened restrictions, kumbaga, that worry you the most under an MGCQ scenario? And where will those points of transmission be really critical as you see it? I mean, just looking at how the scenario will be in this MGCQ normal.
Yeah, all of us, Luchi, want to, go to a new normal or even a better normal. I mean, none of us in OCTA want to stay in this particular quarantine. If we can progress to more loosened context as far as restrictions are concerned, why not? All of us are in support of the government's initiative to jumpstart the economy. But our basic position is this. There's so many uncertainties at the moment. There is already a UK variant in the National Capital Region. We don't know if it's, one could argue it is already in community transmission because the last case got the UK variant here. They did not even go out of the country. They got, so it's community transmission. We just want to know the prevalence. And that's why we're saying, maybe 10 days from now, we might not get a better picture of the situation. That's why we should be cautious. Now, the key thing about MGCQ, it's massive, okay, mobility for a lot of people, okay? And there'll be businesses opening up, that's well and good. But I think what concerns us is the mobility of a larger segment of the population. And that mobility we've seen created outbreaks in Baguio, it created outbreaks in Cebu, it created outbreaks in Davao. Now, we're better prepared now than we were 6 months ago. We know more about COVID now. It's just that we have a new variant. And now, today, breaking news, Cebu has a mutation. Okay, it's not the more contagious and lethal UK variant, but it's turning out to be a mutation. And if they study more about this, they'll probably call it a distinct variant. Whatever it is, it seems to be contagious. You see, when we look at what's happening in Cebu, and it's a cautionary tale for all local governments, just because we're in a good situation now, doesn't mean this is forever, and situations are reversible. And things can get bad, very quickly, especially with this kind of contagious variant. Whatever this variant in Cebu, it looks like, at least from the perspective of our experts, and we have quite a number of medical experts in the team now, no? Not us, not Guido and I, but real epidemiologists studying this. We have fellows from other countries who are part of the team now, and they're saying, this looks like Portugal, this looks like Ireland, this looks like Israel. Cebu. And it looks like there's a B117 infection spreading in the place because when you look at their graph, it's just going up. It's just going up. It started with 11 cases. Now, Guido, it's around what? Close to 300 cases.
But they will say that Cebu. We're talking about Metro Manila now.
Yeah, but the thing is, Luchi, it's important to understand that if we determine that there is a B117 transmission in our community, in Auckland, New Zealand, one family got it. They closed the whole city down. And that with all the vaccines already in place, because this is a deadly variant, and this variant apparently is not easy to cure, and many of the vaccines are not yet tested with this variant, except for Pfizer and Moderna that seem to be working with it. The vaccine AstraZeneca has a poor record as far as this variant is. We don't want it to become the dominant variant here in NCA. That's why we're saying a little time.
Yeah, but Professor David, if we were to take out B117 for now, and we're just talking about the impact of changing the regimes from GCQ to MGCQ, I just want to understand, ano ba tong huling snapshot natin before we leave the regime of GCQ? Are we turning our back on any particular trend? And what are we risking losing or reversing by going to MGCQ?
Well, Robbie, what's been happening is that under GCQ, we've been able to gradually ease restrictions, while at the same time keeping the numbers level, or sabi nga nila, nagpa-plateau. So since October, we've been averaging 400 cases. So we haven't suffered an increase, and that has helped our healthcare system. So, but we haven't decreased the numbers either. But that's not so bad, because we don't really need to reduce the numbers to zero as long as our healthcare system is not threatened. So we were able to balance economy opening up with the public health without increasing the number of cases. Now, if when we relax, when we loosen restrictions, it's almost certain that the numbers will go up because we're already managing to keep it level at this rate. So if we increase mobility, that's going to add more transmission, more potential transmissions, and that will most likely increase the numbers. How fast it will increase, we don't know yet. I mean, even without the B117 or other variant that they found in Cebu, so we don't know how fast it will increase, but most likely it will start increasing because we actually saw that during the holidays when people started having mass gatherings, going out more. The numbers started to increase in December, but we were able to mitigate that with our messaging. We're hoping that maybe the same messaging will be effective, but we're not very confident about that because increasing mobility, reducing social distancing, these are all factors that will affect the increase in the reproduction number.
To that point, Professor Rye, you did acknowledge that in fairness, everything from testing to contact tracing to our healthcare systems, everything has improved. But specifically on contact tracing and your particular concern for mobility, did the improvement on contact tracing, how reliant was that on the lockdown? And now that people can move freely between cities, between provinces, between LGUs, does the improvement in contact tracing keep up with that new reality?
You know, of course, it becomes harder for all of us. You know, contact tracing has vastly improved. But what was constant is always that, the quarantine that kept a significant segment of our vulnerable population indoors. It's not true. It's that we were very strict. We all know that this was not GCQ. This was only Medyo GCQ. No, a lot of people were out. No, and this is the argument of the economic team. It's basically MGCQ, except that without. But the thing is, the age restrictions in MGCQ are far different from the age restrictions here. Okay, we are dealing now with the reality. 6 months ago, we didn't have a B117 variant. Now we have, and we are not certain about its prevalence in the NCR. Now, the NCR is a unique region. it's home to most of the viral cases here. No, it's the epicenter. Number two, it's the lifeblood of the economy. Number three, it's probably one of the densest regions in the country, and it has probably in the world. No,
Yes.
and when you tweak a little bit in terms of loosening in the NCR, it has an impact. The reason why the R has not gone up in the National Capital Region is because Quezon City has managed COVID-19 cases. But I don't know how long. That's why I'm certain Mayor Joy Belmonte voted no, because she knows the data. We gave her a copy of the report. Okay, we are not yet where we're supposed to be as far as MGCQ is concerned. In fact, if you ask government today, by the way, this MGCQ, GCQ was all government's definition. They have prerequisites to become MGCQ. And I'm telling you now, we have not achieved those prerequisites. I'm telling you now, we do not qualify for an MGCQ. Yes, it's been flat for about a month and a half, but we've not gone to the other side of the curve. We're not declining in terms of cases. So that's what we're saying. Let's wait for those, let's qualify ourselves to MGCQ status. Let's not risk it. And we share the position of the WHO resident head here. Now, maybe it's not the time to let our guards down. It's not the time to loosen up. Lalo na when there's so much uncertainty. And just before we start the deployment of our vaccine, isn't it prudent to wait for the vaccines to come and at least inoculate our frontline health workers before we open up? And that's what we're saying. Make it a prerequisite, at least protect our frontline, our frontline, medical frontliners. Should there be a surge, which Guido and I are certain it will happen in NCR, it will be a significant surge because of the nature of our region, that our frontliners are protected. Ano ba naman ang hintayin natin ng konti? Bakit March 1? Bakit nila March 2? Alam mo yun, all of these things are premature, arbitrary, and contrary to sensible epidemic management as far as our team is concerned. And we're hoping the President listens, no? Kasi, and I know he listens, no? And I know they listen to caution, and we've gained so much already. We will lose a lot.
Prof, let's bring in,
if surge happens and we have to lock down.
Let's bring in Ana Marie Pamintuan to Philippine Star. Ami.
Good evening, professors. Professors, mukha namang makikinig sa inyo at baka mukhang i-delay ng konti yan. On the other hand, pati yung si World Health Organization country representative, mukhang matagal-tagal yung timetable niya for relaxing the restrictions considering na mabagal daw yung rollout natin ng vaccination. And here comes the variants. And meron pa nga nung, yung variant of interest na 2 klase sa Cebu. Sa tingin nyo, ano yung safe timetable for starting on MGCQ? Parang medyo matagal-tagal pa yan, ano? Kasi yun ang sinasabi ng economic cluster. Kailan pa natin bubuksan to? Anong magandang sagot doon kapag ganon?
We already suggested an outline. We're just asking for 2 weeks decline in new cases. We're just asking for some sort of certainty as far as the prevalence of B117 is concerned. Number 3, we're just hoping that we consult naman our mayors kasi they're the ones going to be accountable for all of this. And they're the ones going to be managing the monitoring and enforcement of all these new rules and as well as the health standards. So let's consult with them. That's all we're asking actually. We put in a number 4 requirement, a prerequisite. We're recommending they don't have to follow this, but we're suggesting maybe if General Galvez is correct that some vaccines are going to be delivered in March, but hinahintay na lang yung i-vaccinate natin man lang ng 2 doses yung healthcare, and then we open up. I think we're more, it's not sensible naman eh.
Yung mayors daw, 9-8 sa Metro Manila, 9 in favor na.
Split decision nga yun tutusin.
And that should be an indication to the President that there's no consensus on this issue. And that's going to be hard. If half the mayors don't agree, it's going to be hard to push this in a systematic and safe way. The President should listen. Isang boto lang ang nagdiferensya eh. And all the big cities except Manila voted against.
Yeah, and I want to throw that into Professor David, because we don't necessarily know who voted for, who voted against. But I just want to ask, in terms of the number of cases and the cruciality of a particular LGU, not all LGUs in Metro Manila are necessarily weighted, should be weighted the same. Would you agree?
Yes, I agree. I mean, they have equal votes, of course, but I mean, the biggest LGUs are Quezon City, Manila, and Caloocan. I mean, they have the bulk of the population. I mean, if a surge happens, they will have the most difficulty containing the surge, managing it. And contact tracing, you mentioned contact tracing. Once the cases double, it will be hard to maintain the same contact tracing ratio once your caseload starts increasing. So they will shoulder the bulk of the workload here. And in fact, we even argue that how Quezon City, Manila, and Caloocan are managed essentially dictates the management of the entire NCR. I mean, well, that would be putting it simply, but they do contribute a bulk of the efforts in this pandemic management, and of course, well, maybe democratically speaking, they get equal votes.
Yeah.
But I think there should be more consideration for the bigger LGUs because they have more work to do.
Yeah, and it's not just yung population, di ba? I mean, you imagine there are cities like Pasig and Makati that will have more people going in and out every single day once the economy opens up.
Yes.
And Makati has Makati has a problem with the say ito national television. Makati has a shortage of hospital capacity. It has had that shortage for some time now. Now, alam mo yun, these are the cities that need to be supported and in an MGC situation and a surge that might possibly happen. I'm sure we can survive a surge, guys. Let's not be too scared about it. But it's just that it's going to cost lives. And if the surge is going to be powered by a B117, it's going to cost us an arm and a leg to contain it. We might just end up going back to MGCQ. So why take the risk?
Well, yeah. Some of the arguments for MGCQ are, number one, by now people are already observant of protocols, marunong na mag-mask, nag-shield na, naguhugas na ng kamay, etc., etc. And even in private companies, dumarami na rin yung mga pumapasok at hindi naman tumataas ang cases. Hindi ba valid yun?
It's a valid point, but it's largely because people are taking care of themselves. Now, if concentration of individuals increases, if more people are jam-packed in buses now because you have this relaxation and loosening, we will have more opportunities for transmission to happen. Now, okay, we're in agreement. We need to open up, and people are hurting and they're hungry, and the very poor need to be supported. But at this time, we're just saying at this time, maybe wait another month just to see what's going to happen in Cebu, just to see if something will blow up in one of the cities here in NCR, because we do have a B117 confirmed local transmission. Those unknowns for us are things that need to be settled before we open up. And then second, if the government means what it says and says what it means about helping the poor, maybe they can fast track the Bayanihan 3, no? That's being discussed in help with the Congress, fast track Bayanihan 3, and consider giving the poor social amelioration. These are things that we can do quickly right now. Opening up won't necessarily help the poor immediately. I mean, the very poor are divorced from the formal economy. We need to help them in other ways.
That's a good point.
So what I'm saying is that there are other ways to help the poor at the moment. While there's so much uncertainty, let's give time for our scientists, the people from RITM, the National Health Institutes, DOH, the Genome Center, to find out what the state of the pandemic truly is, no, as far as biosurveillance is concerned. And that's, by the way, it's a big issue, and I'd like to stress that. That capability is now a national security concern. It should be a priority to both strengthen and expand the capacity to, in the medium to long term, as far as biosurveillance is concerned. We need more personnel, we need equipment, we need training we need supplies, by the way, reagents, all of that. And maybe the congressman listening to this show can include it in the Bayanihan stimulus package that's forthcoming. We're not sure because our capability is still limited. We can't surveillance as much in all the provinces, and because we have a shortage even of reagents, ang tagal magkaroon ng ma-determine ng surveillance kung anong klaseng variant. And that's all what we're saying. That's what we're saying. Just give us time. Give the people time, the mayors time to prepare, the scientists time to do their surveillance. And once we get a better picture, and if wala naman talaga, they open up tayo after a month. Ano ba naman mag-antay tayo ng isa pang buwan? That's all that we're saying. Let's just settle the unknowns and uncertainties before we open up.
For 1 month.
Would you agree that it would be more difficult to open up and then close again than to wait for another month? I mean, di ba? Parang I would imagine na pag nag-MGCQ tapos nag-surge, biglang, oops, balik muna sa GCQ ulit. Isn't that, I mean, how easy or hard is that? They might argue na, hindi naman problema yan eh. Di pag nag-surge, di balik ulit sa GCQ. Is that, does that wash at all as an argument?
I don't know, Gids, what do you think?
I would agree it's more difficult because what we saw last time we had the surge nung August is it's faster to get to a point during a surge, and it takes more time to get from that point back to the original. It took us maybe 3 months to get back to a level that was, comfortable for us, that we could manage. So once we get to a surge and we get to have a lockdown like MECQ, it's actually going to cost us more economically because the lockdown costs us a lot of money, and our government maybe does not have the enough funds for a lockdown. I mean, unlike before, so that would be problematic.
Also, may lag din kasi in between the time when you get infected and the time you start showing symptoms. So by the time you do realize that there is a surge coming in, there are more people out there already infected than have not yet reported.
Overwhelmed na yung system.
Just to give an example, guys, sa Ireland, about 5% prevalence of the B117, it took about 3 to 4 weeks before it hit. In Ireland, they were averaging parang 300-400 cases a day by Christmas time. After the Christmas holiday surge, so that's something 3,000-4,000 cases a day. So it takes time. If we find out the prevalence of this new strain, then maybe we can make better decisions. Either we cannot open up without data. Good data. It can't be just about emotions and feelings. You're right, Luchi. Kasi it's not just the economic cost. The social and political cost will be very high. Confidence in the government will go down if people suffer because of a surge. So this is and by the way, we have a new survey coming out next week, a national survey na po to. In our December survey, while 93% do follow health protocols, they don't follow it every day. Only 83% on an everyday basis wear masks. 61% wear face shields. So 67% do social distancing. So it's not true that we're following. In fact, it's deteriorating over time.
You said deteriorating. Just before I could ask my question, is that more or less the same, better, or worse than the last time you reported some incongruity between what people say they do behavior-wise and what they actually do?
We're doing the summary for the new survey. It's a 1,200 respondent national survey. And just be advanced picture lang, we're still studying it. It's pretty much the same. And it's, by the way, very interesting. Willingness to get vaccinated is it's at its lowest now.
Yeah.
Talaga? It went down pa.
It went down pa nationally.
1 in 4 na kayo.
But what about on the matter of opening up? Is it meron na bang, did you anticipate this question of ready na ba kayo to go out kung mag-MGCQ?
We didn't ask them that, but I mean, it's pretty clear in some of the survey questions we ask about what the urgent personal concerns, and for NCR, the personal concern was the number one concern was really jobs and incomes. No? We can see that in NCR that this was very distinct. Overall in the country, the number one concern is not getting sick.
Yeah.
What was the
It's not
reason
even
natin?
jobs or incomes. It's not getting sick.
Yung pagbagsak ng vaccination, interest in vaccination, what was the reason? Did you ask for the reason?
Well, okay, hindi pa kasi inaayos pa namin, no? Pero 70% are scared are concerned about safety. We even asked about vaccines created, developed and produced by country.
Yes.
And again, there's a world of a difference between willingness of people to get vaccinated by a drug made in China versus a vaccine made in the United States. So there's a wealth of information we will share with your show next week. Now, once we get everything in place,
Yeah.
and it paints a picture of uncertainty as far as the vaccination is concerned, or vaccines in general, both in terms of safety and efficacy. And it also paints a picture of compliance, of deteriorating compliance, and this is nationwide.
Yeah. Pero Professor Rye, you mentioned that number one concern pa rin ang health. Ayoko magkasakit. Pero mataas din talaga yung concern for jobs and livelihood. But something that you said kanina, can you flesh out what you said? That you said, na, look, let's also remember that when we open up the economy, it does not actually necessarily mean that it's the masses and the people in the lower income demographics are the ones who will immediately benefit. Can you flesh that out? I mean, what do we anticipate? When we reopen the economy, who immediately benefits? Is it the blue-collar workers? Is it the white-collar jobs? And how long before, all the benefits trickle down to everyone?
Well, we're not sure about that, Robbie. That's why we even explained in many of our interviews that NEDA should explain why we need to get 15, 16-year-olds out. Out in the streets. They say there's an economic benefit to that, and it would be good even if NEDA talks about it more. We're uncertain, Robbie, that these suggestions by, initially kasi age restrictions na pinag-uusapan
Yeah.
Now nag-MGCQ na. Now if certain businesses will be reopened, definitely it will help those who need jobs access to incomes and jobs, no? But the very poor have always been divorced from this formal economic structure. So they actually need handouts and dole-outs talaga. Kasi they need a helping hand. Maybe that's not the proper word to use, no? But they really need help right now. And I think if they mean to help that segment of the population, then maybe a legislation like biennial 3 would be useful.
Okay, what if they say, okay, you're saying, why can't we wait another month? That's also what they're saying. What difference will a month make? Diba? Yun din ang argument nila eh. Why wait another month? Bakit nga ba? Because you just said, why can't we wait another month? So,
now, the B117, the UK variant, we just need to get a better picture of its prevalence here. That takes some time. Second, I think our mayors, the 8 who did not vote for it, will be probably more prepared for an MGCQ and would probably have contained. There are outbreaks now in Navotas and Valenzuela. There are actually increases in upticks in 8 cities. 8 rin ang bumotong hindi, no? So, people are better prepared. This is not something that was discussed a month ago. It was just discussed last week, and for many of the mayors, nabigla rin sila dito. And there's because of the uncertainties, so 1 month will provide us good information. 1 month might even buy us time for the vaccines to come out here, to be delivered here and rolled out. Sabi nga ni General Galvez, baka daw sa March, makadating na yung ibang vaccines natin.
So, baka mag-set na lang dapat ng deadline, no? Sabihin, okay, mag-MGCQ na sa April 1, pero dapat maghanda na kayo. Pwede bang gano'n? Can we approach it this way?
Yung point ng group namin ni Professor David is instead of setting deadlines, why don't we set conditions for opening up? I mean, the IITF has a prerequisite to move from GCQ to MGCQ. There should be certain health conditions and milestones that have been reached. Okay. Why don't we work on that?
So Professor
I'm
David,
sure we've not yet reached those milestones.
Yeah,
Number two,
No, yeah, I mean,
Yeah, go on.
So what should those milestones be? What should be, I mean, you already mentioned one, I imagine, healthcare workers, bare minimum, let's have them vaccinated. What else?
Well, it's very clear sa amin, from our own standpoint, there should be 2 weeks of actual decrease in new cases. And that's what we're looking at. If we're on the other side of the curve, that's generally, because the basic question, have we managed transmissions? I mean, that's the basic question always posed by the WHO. And in our view, here in the NCR, while it has plateaued, I don't think we can say with certainty that we've managed transmissions here. In fact, there are upticks all around the place. So this is the key question, Joby. If we've managed transmissions here, then we can open up. And so the criteria set is 2 weeks, okay, decline in new cases. Number 2, we have enough surge capacity, healthcare capacity, and I think we have that already. Okay? So maybe para sa akin, minimum na nga yun eh.
Yeah. Yes. How bad can it get if we do have a surge? Will it be as bad as the August surge we had, or maybe even worse?
Guido has a projection. Gids.
Yeah.
Yes, Luchi. If we have a surge, Professor Rye will be even more angry than he is now, for sure. But as we mentioned, we did the model, and if we do have a surge similar to what happened in Cebu, the reproduction number increased to about 1.6, and right now our reproduction number is 1. And the difference is, if we hold the reproduction number at 1 in 36 days, our numbers will be about the same. It's about 400 cases. But in the case of similar to Cebu, if we have the reproduction number go up to 1.6, as if let's say we have a variant here, then it will be up to 2,400 cases in about 5 weeks. And I think Robbie or Ed mentioned that we might not even have time to react to that because of delays. And the trends will not be clear until after maybe about 2 weeks. And then even if we try to put a stop to that, the effects will not be immediate. And that's part of the problem. It's more difficult to slow down a surge. I mean, it's like a snowball effect. And in fact, I think we talked about that last year in the same program, the snowballing effect, and how difficult it is. And we have made a lot of gains from August of last year to where we are now. Sure, we haven't flattened the curve, but in terms of reviving the economy, yes, we have done that gradually. We've opened up a lot of business sectors, so we've made a lot of gains, and it would be sad if we let that go to waste if a surge happens.
Okay, professors, we just need to go into a break, so we hope you don't mind if we ask you to stay for a few more questions after this break. So please stay with us. We'll just go into a break, so also please stay with us.
Starting today's newscast with lawmakers insisting that there's no need for a separate law to hold vaccine manufacturers accountable. This as some believe that the lack of indemnification is causing the delay of arrival of COVID-19 vaccines.
The vaccine shipment from Pfizer through the COVAX facility is facing delays, pending one missing requirement.
Magandang balita po na talagang napirmahan niyo na po yung mga Senate bill na nakikita natin na makakatulong po sa atin. Nais namin din magpasalamat sa miyembro ng mga Senado at sa mabang kapulungan napakalaking suporta sa kanilang ibinigay sa ating National Vaccine Program.
Welcome back, the Chiefs, here on One News. We are now in the final stage of our conversation. Still with us are Professors Guido David and Ranjit Rye of OCTA Research. Now, prior to the break, we asked, how different is that August surge going to be from what's being modeled if we enter MGCQ. And Professor David, you made one very clear point that, well, one thing that's different is that August, wala pa yung B117 na yan. So, could you take us deeper into B117? How exactly does B117, mathematically, when you plug it into your models, how exactly does it change the modeling?
Well, Robbie, of course, just as a background, the B117 variant and some of the similar variants that they found in South Africa, they have a mutation in the spike protein that makes it more more adhesive, so so people get to capture the virus more easily, and it becomes more infectious. And in fact, what we have seen is that the reproduction number increases by about at least 0.5. This is what they saw in other countries, but here we're seeing it's almost like a 0.6 difference. So this is what we're seeing in Cebu City, and we even saw that also in Mountain Province, in Benguet. And that's why even before they identified the variant was there, we made the suggestion that the possibility was there that they had the variant even before they had the sequencing. So this was also done in Cebu. I mean, we also made the same statement in Cebu that perhaps the variant is there. And that's because we saw the signature that the reproduction number increased by this much. And that is a telling sign. And of course, we didn't have the evidence to back it up because the evidence is in the genome sequencing, but it was a telling sign. And that is what could happen to Metro Manila. We would have a surge if that variant takes hold here and the reproduction number replicates the same value that we saw in Cebu. We could have a surge similar to what we're seeing in August, maybe even quicker, because it will take us just 5 weeks to get there. Whereas last year, it took us maybe almost 3 months to get to that level.
Professors, in the meantime, there are preparations for limited face-to-face classes, and in fact, they're saying, papayagan na daw for medical schools. Are you factoring this into your projections kung anong mangyayari if this happens?
Well,
Go on, Jeet.
Yeah, limited face-to-face classes. We're not actually opposed to medical students having, face-to-face classes because medical students will be our frontliners anyway, and they have to get used to that fact. But if we add, more students having face-to-face classes, more colleges opening, that will definitely factor into the model. And we haven't even considered that fact. But it will increase mobility even further than what we had in our model. So definitely it would add a few points in the reproduction number.
What if private office? Go ahead.
Baka sa matagalan, di ba? If MGCQ, baka pati yung sa education, gradual reopening. You're also worried about that.
Sa MGCQ college ang face-to-face college.
The discussion about this was made in July. We were invited to that. I think even that was the same time, no? Cabinet meeting. We were invited to present there, and that was discussed as early as July. That in places where there's hardly any COVID transmission, that there will be limited face-to-face classes. And knowing CHED, knowing DepEd. And the technocracy in both institutions, they'll be very cautious and careful about reopening classes. Of course, July is very different from the situation now. No, the virus has spread all over the country, so this will be extremely limited. No, and will be subject to so many precautions. I'm told, personally by friends in both institutions. So this is not going to happen, obviously, here in the NCR, except for the medical schools, which, by the way, are going to take extreme precautions to ensure that their students are not going to be infected. The key issue here, and we'd like to state this, no, because I got a text from some friends now watching. We're not against the MGCQ. We're not just for it at the moment, no, at this time. Okay, when we qualify, when the NCR qualifies based on its health indicators to become MGCQ, then we will fully support. When we know the situation about the B117, we get a clearer picture, then maybe we should open up. But until we get all of these things cleared up, until we qualify, maybe it would be better for, just as the perception of 8 mayors, no, in the council, maybe it's better to stay under GCQ so there's still some more semblance of control until we improve the situation and get a clearer picture of the prevalence of this new variant spreading in our communities.
Yeah, but Professor David, I mean, I think you've already established before that, you're proceeding from the assumption when it comes to B117, it's not a question of whether or not it's here. We assume that it's already here in Metro Manila. So beyond that premise, what specifically would you like to see over the next few weeks that will indicate to you that the presence is at a certain level that either pwede tayo mag-MGCQ or not?
Well, Robbie, that's a good question. And I think we would need more biosurveillance conducted here in Metro Manila. Right now, the biosurveillance is being done in Cebu. And in fact, I think they've detected prevalence of that new variant, the variant of, the suspected variant in Cebu. I think that there's like a 70% prevalence there already based on the sample size that they're using. It may not be as prevalent because we don't know yet, and they haven't done a lot of sequencing here in Metro Manila because of the cases are not really increasing that much. But I think they should conduct more biosurveillance in Metro Manila to at least give us a sense of how much of this variant is around here, and maybe there's not just one variant. I mean, there could be different variants around here. We don't know if other variants have entered the Philippines. I mean, we know that some of the variants, like the UK variant, came from outside the country. How did it get here? Well, if that's the assumption, then it's also possible that other variants have entered Metro Manila and the Philippines.
Which area of mobilization is really most sensitive? Is it for example, the transport, di ba, na yung mga magtatrabaho ngayon or yung lalabas, syempre kailangan na sumakay ng bus or train or whatever, because as far as private offices are concerned, no, so far medyo maingat sila sa protocols, no, and they're very strict with testing, contact tracing, etc., etc. So what are you seeing will be most difficult to control?
They're going to be in MGCQ. Almost all businesses are open.
Yeah.
MGCQ is a technical classification. It assumes that the virus is already managed and contained in the community, that we've managed transmissions already. So the impact of the increase in mobility in general, not one particular, in general, is the one that's troubling. Now, just to and Guido can attest to this also, or say, looking at the numbers, no. According to some of our epidemiologists in the team, if B117 or UK variant adds 0.5 to the reproduction number. So kung 1 yung reproduction natin, kung kumakalat, kung prevalent ang B115, 117 pala, it's 0.5. Yeah, something like that, no? So that's a lot, guys. That's a lot. And when you look at the reproduction number now in Cebu, it's close to 2. Tama ba, Guido? It's close to 2?
It's about 1.6. So it added about 0.6 to the reproduction number.
Kasi sinasabi nila yung mga, kasi sinasabi ng lahat, of course, I haven't been out myself, no? But when you go down to the malls, puno, when you, when you're in traffic, parang back to normal na. So people are just saying, it's for all intents and purposes already MGCQ.
Yeah, that's what they say.
Yes, yeah. So, hindi pa yun. In other words,
Why not formalize it? Well, there'll be more businesses open, Lucci, under MGCQ. Most of the restrictions will be relaxed under MGCQ. We don't know if the mayors will pick and choose. The good thing about NCR mayors, all of them are, oriented towards science and data. They're all very strongly protective of their constituencies. And we've got privy to some of the arguments made, and they're legitimate naman. And it's a matter of appreciation and perspective also. But the fact of the matter is, this will be it will be very hard for a region as complex and as dense as NCR, to just have a wholesale MGCQ. So most likely, if it does pass, and if the president does approve it, it won't be the kind of MGCQ that we see in other provinces. Maybe some businesses will remain closed because of the nature of the region. Masyado maraming tao dito, and the possibility of transmission is quite high. So maybe certain businesses will be, certain opening of certain businesses will be rolled back, no? So
Dr. Guido,
this is what we're saying now.
yeah, but Dr. Guido, some people are also arguing that the death rate has not really risen and the death rate is pretty stable. I mean, isn't that a factor also that we should take into account?
Well, Lucy, the death rate is stable, but when we do have a surge, because the death rate is a proportion, then if we have a surge, let's say we're averaging 400 cases per day now, and from those 400 cases, our death rate is maybe close to 3%. So that means 12 out of those 400 will die. So if we have a surge to 2,000 cases, then that will still mean more deaths, in the absolute sense. Even if the rate is the same. So it will still lead to more deaths. And plus, there is a complicating factor in that the variant, well, we're not aware of this new variant that they found in Cebu, but at least as far as the UK variant is concerned, even the death rate is a little higher, or is higher compared to the previous variant. And in fact, there's a study that accounts for this. So that is also something that we should be concerned about.
Well, professors, one argument kasi being put forward for MGCQ is the fact that the mayors will still retain their authority to impose hyper-localized lockdowns. Does that make any sense?
We agree, no? This is not the end of the world, and if government decides, OCTA, like everyone else, will be happy to continue supporting and doing its work as far as informing the public to be more vigilant and safe. But I like to put three things on the table. Number one, the B117 is not to be trifled at. It's not just more contagious. The latest study that was published in the UK shows that it's lethal. It also shows that this variant is also harder to cure. It's not easy, to cure using our own standard modalities that we've been used to, that we've been successful in curing patients that get into the hospital. So that's a lot of people die. Number four, and this is a game changer, some of the vaccines don't work. Some of the vaccines we're getting are not going to work. We don't have data to say that they're going to work when this becomes prevalent, this variant becomes prevalent. That's on the table. That's something everyone has to put into consideration when we decide to loosen up and put our guards down and let this variant spread around the region. That's the thing that we want to find out. If it's not prevalent, then okay, let's open up. But if we don't have clear data about the prevalence of this new and more contagious variant and lethal variant, why are we taking the risk? Let's get the data first. That's why our professors always tell us, during the undergrad, in our science classes, Robbie probably remembers, before you say something, get the data first. So that's what we're saying. Let's get the data first and maybe wait a few more weeks before we just go into this with our eyes closed and hope that things will get better. With our head in the sand and hope that things will get better. Hindi naman tama yun eh. Suntok sa buwan. This is not scientific. We believe it's premature. And it's risky and, contrary to sensible epidemic management at this time.
Okay.
Maybe some other time it will be better.
Okay, Professors Ranjit Rye and Guido David of OCTA Research. Professors, maraming salamat po for joining us tonight again.
Thank you.
Thank you.
Maraming salamat.
Salamat. Ingat tayo lahat.
Well, as we said a while ago, we're expecting to bring in another guest, but Dr. Mary Jean Loreche of the Health Department's Region VII was, well, she was supposed to join us tonight, but unfortunately, she had an urgent meeting that she needed to attend to. So that'll be all for this Thursday edition of The Chiefs. We hope what was discussed here will keep the conversation going. I'm Edlin Gao.
I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.